Our top story now, NITI Aayog member VK Paul told NDTV that a plan to involve the private sector in the vaccination process will be announced in a few days. Remember, this has been a demand by many given the slow pace of vaccination drive so far. VK Paul also spoke to NDTV about the emergency use authorization for the Russian Sputnik vaccine in India.
Dr. Paul, when will the private sector be able to vaccinate citizens, particularly those above the age of 50?
Well, presently also, Vishnu, the private sector has been so eminently involved in the vaccination program for the healthcare workers as well as the frontline workers. Out of 10,000 sessions, let's say on a given day, 2,000 sessions are being conducted by our private sector partners, and they have done such a splendid work. And as we move to a much speedier vaccination program, amazingly speedier vaccination program as we move to the next phase, the private sector engagement would be deeper and wider. We will be coming forth those guidelines and we'll be unveiling this program pretty soon.
How soon would that be, sir?
In a matter of a few days. Just wait, and I assure you that private sector will play a very, very important role to augment the speed and the reach of our vaccination program, even as the public sector would be engaged very, very deeply and intensely. It's a partnership of both public and the private sector.
When will the Sputnik vaccine be cleared? Is there any way to speed up the vaccination process for under 50 citizens?
Well, firstly, we are very happy that Sputnik has applied. Dr. Reddy's laboratory, on behalf of the initiative, has applied for authorization, and let that process unfold in coming days. And you know that we undertake this process very expeditiously because we want as many vaccine options being made available to our people as possible. And therefore, we welcome this move and we are excited about this move. And once that decision is taken, I also know that in parallel, there are a few companies, two or three companies with which they have arrangement to start manufacturing this particular vaccine in our country.
Now, if we take a look at the situation in states, Maharashtra Chief Minister Uddhav Thackeray has warned there could be another lockdown across the state if the COVID numbers keep going up. He said there would be clarity on this in 8 to 15 days. Meanwhile, in some parts of the state, Amravati, for example, there's already a lockdown in place till the 1st of March. In Pune, the positivity rate has been galloping. All this in the midst of official statements that mutant strains of the virus may already be making their presence in the state.
आता शेवटचा प्रश्न आहे, लॉकडाऊन करायचा का? या प्रश्नाचं उत्तर मी पुढचे 8 दिवस आपल्याकडनं घेणार आहे. कसं घेणार? येऊन तुम्हाला भेटणार का? नाही. मी बघणार. ज्यांना लॉकडाऊन नको आहे ती लोक ह्या सूचना ज्या आहेत, मास्क वापरणं, हात धुणं आणि अंतर ठेवणं हे पाळतील. आणि ज्यांना लॉकडाऊन हवा आहे ते विना मास्कचे फिरतील.
With Mumbai cases doubling in a week, the Maharashtra Chief Minister is getting tough. In Amravati, the government has already announced a lockdown till the 1st of March after there were 5,000 cases in the past 10 days. There are concerns that parts of Maharashtra, including Mumbai, Pune and the Vidarbha region, may be seeing the beginning of a new wave of corona cases. In Pune, the positivity rate has now touched 10%. It was between 4.5 to 5% just 15 days back. The biggest worry is the impact of new mutant strains of the virus, which have been detected. Data is still scarce, but experts have said that the rate of transmissibility is much higher.
If you have a lot of variants or mutations which occur in the virus, your immune response to that will fall and you will be prone to, you could call it reinfection or infection with a new variant to which the immunity is not that strong.
The new rules state that from 11 a.m. to 6 a.m., there will be action against those who walk out unnecessarily on the roads. Fruits, vegetables and milk vendors will be allowed to go out. Schools and colleges will remain closed till the 28th of February. Hotels, restaurants are allowed to stay open until 11 p.m. Police permission is required before marriage, political or social programs.
आपण शाळा म्हणतो तेव्हा शाळा आणि कॉलेज हे दोघांचा समावेश त्यामध्ये आहे. तसेच आपण या दरम्यान जे खाजगी कोचिंग आहेत आणि खाजगी ट्युशन क्लासेस आहेत जिथे फिजिकल इंटरॅक्शन होत आहे तो सुद्धा बंद करण्याचा डिसिजन या कालावधी पुरता घेण्यात आलेला आहे आणि या कालावधी नंतरचा निर्णय त्याच्या नंतर घेण्यात येईल. याच्या व्यतिरिक्त हॉटेल्सची जे टायमिंग आहे, हॉटेल्स, बार्स, रेस्टॉरंट याची टायमिंग तो कमी करून 11 वाजता करण्यात आलेली आहे.
Given this sudden increase in COVID cases, such harsh decisions are being taken by the Maharashtra government. Although experts say it would be too early to call this as the second wave of COVID in Maharashtra. In Mumbai, with camera person Rajendra Dayalkar, Sohit Mishra, NDTV.
And it's not just Maharashtra and other states as well. And the centre has written to several states which have witnessed a spike in daily new cases and asked them to increase testing as well as surveillance in order to control the situation. These states include Maharashtra, Kerala, Punjab, Madhya Pradesh, Chhattisgarh and Union Territory, Jammu and Kashmir. Well, let's go across to NDTV Sukirti now for more. Sukirti, the centre has asked that the testing be increased and also the checking for the variants of coronavirus.
Well, yes, so far the debate has been revolving around mutant strains in Maharashtra, but the centre has now written to all of these states which are seeing a surge, Chhattisgarh, Madhya Pradesh, Goa, Punjab. All of these states have also been written to, and they've been asked not only to increase the number of RT-PCR tests and mandatory RT-PCR tests for those who are testing negative and antigen tests, but also these states have been asked to monitor if there are cluster of cases that are emerging at any places and to carry out checking on whether there is presence of any mutant strains. There should be regular genome sequencing as well. So that is also being asked for from all of these states now. And these states are a big worry because while the national average of weekly positivity rate is around 1%, these states have their positivity rates at anywhere between 3% to 8%. And especially because India has come a long way in this battle against COVID, where we have been seeing a decline in cases across the other states. But these states in the last 1 or 2 weeks have been showing a surge in cases, and that is why they've been asked to control the situation, and testing, tracing and isolation has been the key for the Indian government, and that is why all of these states now being asked to not only increase the number of tests but also carry out checks if there are any mutant strains that could possibly be present.
All right, Sukirti, thanks so much for joining us there with those details. Now, in Punjab, healthcare professionals and other frontline medical workers who skip the COVID vaccination won't get financial help from authorities for treatment if they get infected later and won't be allowed to take quarantine or isolation leave. That is what the state government has said. The state government has taken this serious view of reports that some healthcare workers are choosing not to get vaccinated amid rising cases of COVID in states and a low rate of inoculation in Punjab. Well, let's go across to NDTV's Mohammad Ghazali now for more. And Ghazali, while of course taking the vaccine is something it's left to the people's choice. However, Punjab announcing these measures given the low vaccination rate.
Yeah, exactly. Punjab is I'll say, in a double fix. One, the centre has already highlighted time and again the rising number of cases in the past few weeks. Why there is a surge. Apart from that, since the COVID outbreak, Punjab has consistently been reporting the higher fatality rate than the national average, which is still there. So the government is trying to go towards vaccination in order to inspire more people, but even the vaccination rate is very low in Punjab. It is among the lowest of all the states where healthcare workers and frontline workers had to be vaccinated. So this another dictate sort of order coming in from the health ministry yesterday, that those healthcare professionals who won't get vaccinated will not get any benefits later if they get infected. And also, if they get infected, they will not be given the quarantine leaves or offs to those employees. So certainly government is trying to push for it, because we had seen that once COVID outbreak was there, in the rural areas, even people were not even going for or coming forward for the testing or sampling thing. So the government is trying to encourage through vaccination program so that people can also, the rest of the healthcare workers can come out for vaccination. And more than that, since the center has already asked them to ramp up the testing and RT-PCR tests, certainly the government will have to focus on that as well to check the rising cases, because in the last few weeks, there have been cases reported from the schools where teachers and students have tested positive. So certainly experts feel that the guard has been lowered in the last few months, thinking that the COVID spread has been checked or it has come down. But the cases are rising again in the last few weeks, and Centre has rightly asked Punjab to take care of that.
All right, Ghazali, thanks so much for joining us with those details. So that's an effort by the state government to increase the inoculations in the state. Now, if we talk about the treatment for coronavirus and the kind of immunity boosters, etc., yoga teacher Ramdev on Friday released a research paper on what he called the first evidence-based medicine for COVID by Patanjali, Coronil. This was in the presence of two union ministers, Union Health Minister Dr. Vardhan and Union Minister Nitin Gadkari. But now another controversy has erupted after the World Health Organization said it has not reviewed or certified the effectiveness of any traditional medicine for the treatment.
COVID medicine Coronil, developed by Yoga Guru Ramdev's firm Patanjali, is again at the center of a controversy. The World Health Organization has clarified in a tweet that it has not reviewed or certified its efficacy. On Friday, Patanjali had claimed that Coronil is the first of its kind evidence-based medicine that can protect people from coronavirus. The launch event of Coronil was attended by Union Health Minister Dr. Vardhan and Transport Minister Nitin Gadkari in the presence of Patanjali Ayurved promoter Baba Ramdev. Patanjali had issued a statement saying, Coronil has received the Certificate of Pharmaceutical Product or COPP from the Ayush section of Central Drug Standard Control Organization as per the WHO certification scheme. One of the directors of Patanjali, Rakesh Mittal, had tweeted, Patanjali has made history in the field of Ayurveda as Coronil has been recognized by WHO as first evidence-based medicine for corona. He later deleted that tweet. However, Patanjali's managing director Acharya Balkrishna had later clarified that WHO neither approves nor disapproves drugs. So what is WHO's certification scheme? The WHO has provided provisions and benchmarks for such certifications, but does not certify or approve the medicine itself. WHO's GMP or Good Manufacturing Practices guidelines provide a set of quality control benchmarks to ensure that drugs are consistently produced and controlled to the quality standards appropriate for their intended use. If a country wants to import Patanjali's Coronil, it will request a CPP or Certificate of Pharmaceutical Product from India's drug regulator DCGI through Patanjali. The certificate will be issued by DCGI in accordance with the WHO's guidelines. The opposition also attacked government on the issue. Citing the WHO's clarification, Shiv Sena leader Priyanka Chaturvedi tweeted saying, I hope our health minister stops embarrassing the nation with such claims to promote Coronil. I strongly believe in Ayurveda, but to claim it as a WHO guaranteed cure against COVID and endorse it is nothing but cheating as well as misleading the nation. NDTV reached out to Patanjali and the Union Health Minister, but they remained unavailable for a comment. Last year in July, Patanjali had claimed that Coronil could provide strong protection against coronavirus. Later, the Ayush Ministry released a statement saying that Coronil could be sold only as an immunity booster and not as a cure. In New Delhi, this is Sukirti Dwivedi for NDTV.
Political news now, and leaders are headed to poll-bound states today. While the Prime Minister will be in Assam and West Bengal, Congress leader Rahul Gandhi will be in Kerala. The Prime Minister will dedicate to the nation important projects in the oil and gas sector in Dhemaji in Assam and lay a foundation stone for an engineering college during the event. He will then later in the day inaugurate several railway projects in Hooghly in West Bengal. Congress leader Rahul Gandhi will attend a tractor rally in Wayanad in Kerala in solidarity with the ongoing farmers' stir. Now, the latest on Puducherry, and two more MLAs resigned yesterday in a major setback to the ruling Congress a day before the trust vote, which is today. One of those who resigned is from the Congress, the other from the DMK, its ally. The 33-member House now has a strength of 26 and the Congress and allies have just 12 and the NR Congress-led alliance 14. There could be 4 possibilities in that case. The government could fail and the government could survive, or Chief Minister Narayan Swamy could dissolve the assembly to scuttle the possibility possibility for the opposition NR Congress forming government with polls due in May. The governor may also bring Puducherry under president's rule.
Honorable ministers, honorable MLAs of Congress and DMK Alliance Party members, and honorable MP, honorable our PCC President A.V. Subramaniam, we met and discussed. Honorable Deputy Speaker was also there. We discussed about the strategy to be adopted by our Alliance Party in the Assembly, Legislative Assembly. Finally, we have decided that we will disclose our strategy in the floor of the House at the time when the Assembly commences.
Time for us to slip into a short break. On the other side, we'll get you political developments in West Bengal as the CBI arrive at Mamata Banerjee's nephew's home. Stay with us. As fuel prices are at a historic and unsustainable high, petrol has breached the 100 rupee litre mark in many parts of the country. Congress interim President Sonia Gandhi wrote a letter to the Prime Minister regarding the fuel price rise, saying that she is baffled that prices increased despite moderate international prices. Crude oil price is half of what it was during the UPA regime, and clearly the government has chosen to profiteer off of people's misery. The latest on the farmers' protests, and Bharatiya Kisan Union leader Rakesh Tikait has now clarified his appeal to farmers to be ready to burn their crops should not be taken literally, and he made this clarification after farmers in some parts of Bijnor reportedly destroyed their wheat crop.
आपको हाथ उठा के करना पड़ेगा कि एक फसल की कुर्बानी की जरूरत पड़ी तो खड़ी फसलों में आग लगानी पड़ेगी। हटाओ, एक फसल की कुर्बानी देंगे तो 20 साल तक किसान जिंदा रहेगा।
So that is the statement made by him earlier, which has actually led to farmers burning their crops, and he has made a U-turn and urged farmers not to destroy their crops. He said, I appeal to farmers not to do this, did not ask for this to be done. News from Haryana, and the Haryana government seems to be in no mood to soften their stand on the farmer agitation. While almost every day of Mahapanchayat is being organized in the state, the government has suspended 2 teachers and a program officer with the education department allegedly for participating in the farm agitation. Sources say the government will take strict action against its employees for participating in this agitation.
हम 3 गुना एकता के साथ लड़ रहे हैं।
Ajay Balhara, a program officer with the Education Department in Haryana, was served suspension notice last month. Though Balhara's suspension letter doesn't cite any reason, he says that participating in farm agitation led to his suspension.
मेरी 27 तारीख की फेसबुक लाइव जो थी, करीब वो पौने घंटे की फेसबुक लाइव थी, जिसमें किसानों के आंदोलन के बारे में मैंने अपने स्वतंत्र विचार रखे और 26 तारीख की घटना के ऊपर भी मैंने विचार रखे थे। वो डाउनलोड करके केंद्र सरकार से कोई सीडी आई है। शाम को मेरे घर पे कोई कर्मचारी जो है निलंबन का आदेश लेके आता है और निलंबन के आदेश के अंदर मुझे कोई कारण नहीं स्पष्ट किया गया है। केवल उसके अंदर ये लिखा कि आपको धारा 5 जो है उसके तहत, जिसके अंदर सरकार के खिलाफ साजिश रचने का जो इल्जाम है वो होता है, उसके तहत आपको तुरंत प्रभाव से निलंबित किया जाता है।
मिड डे मील सब्जी रोटी ये हलवा पूरी थारी।
A junior basic training teacher posted in Rohtak, Rajesh Dalal, is a Ragini singer but now faces suspension for having sung for farmers.
सस्पेंड जी, गवर्नमेंट का आरोप है कि मैंने सरकार विरोधी काम किए, जबकि मैं है लोगों के मनोरंजन को लक्षित करते हुए किसी भी रचना को शौर देने में मतलब मेरी अपनी रुचि है और मैं रागनियां गाता हूं। ज़्यादातर शिक्षा के भी गीत लिखे हैं। हमारे स्कूल का राजकीय प्राथमिक पाठशाला चिड़ी ब्लॉक का पिछली बार स्टेट में 2nd पोजीशन आई मेरे बच्चे की। अब गवर्नमेंट ने तब तो कोई पुरस्कार देने की बात नहीं।
This farm agitation has received support from many unions across Haryana, including the Teachers Union. But the civil service rules has many clauses which bars employees from participating in agitations. Rule number 13, named Criticism of Government, says can't make any oral or written statements criticizing the government policy. But legal experts feel these rules can be challenged.
रूल 9 में कहा गया है कि कोई भी गवर्नमेंट एम्प्लॉय किसी भी ऐसी ऑर्गेनाइजेशन से नहीं जुड़ेगा जो पॉलिटिकल एक्टिविटी में पार्टिसिपेट करती है। तो इस तरह से तो देखिए कि कोई सरकारी कर्मचारी का कोई मौलिक अधिकार ही नहीं बचता है।
But the chief minister is firm.
किसी भी सरकारी कर्मचारी को इस प्रकार के आंदोलन में जिसमें वो सरकार की व्यवस्थाओं से अतिरिक्त हो ऐसा भाग लेने का बिल्कुल अधिकार नहीं है।
The government has reiterated that employees won't be allowed to participate in any agitation, and hence after farmers, now teacher unions have decided to protest against the suspension of their colleagues in Haryana. With Mohammad Ghazali in Chandigarh, Revati Hariharan for NDTV.
News now from Madhya Pradesh. And a 20-year-old woman in the Shahdol district was kidnapped, kept captive at a farmhouse for 2 days and repeatedly gang raped by 4 people is what she's claimed. One of the accused is a local leader of the ruling BJP. The rape survivor's family said that she was kidnapped on the 18th of February when she had gone to buy groceries, but initially they didn't lodge a missing complaint, thinking she may have gone to her relative's house. She was found in an unconscious state near her house on the 20th of February, hours after they actually filed that complaint.
और इस महिला ने शिकायत करी है कि 4 लोगों ने उसको कार से उसको जबरदस्ती एक जगह पर ले गए और वहाँ पर एक व्यक्ति ने उसके साथ रेप किया है। बाकी लोगों ने उसमें सहयोग किया है। इस प्रकार की रिपोर्ट पर से थाना जैतपुर में अपराध पंजीबद्ध हुआ है और अपराध पंजीबद्ध करके थाना जैतपुर उसकी भी विवेचना करेंगे।
Well, let's go across to Anurag Dwari now for the latest. And Anurag, very, very serious, allegations made by this woman about kidnapping and gang rape and also the involvement of a local leader.
Yes, Gargi, a 20-year-old woman was gang raped allegedly by 4 persons, including a BJP functionary who is the mandal president. But I can tell you, because BJP issued a press release late in the night saying that the accused office bearer had been removed from its primary membership of the party. This victim was allegedly abducted in a 4-wheeler and forced to drink liquor in a farmhouse in Gadkari area, and then gang raped on Feb 18th and 19th as per the police. And all the accused were absconding. But as of now, the police is searching for them, but the BJP has acted in this matter, and the name, because of the name of the Bijapur Jaitapur Mandal Chief Vijay Tripathi, and now I can confirm that the BJP issued a press release informing that he had been thrown out of the party. Gargi.
All right, Anurag. So the BJP, they're issuing that clarification that the accused leader has been thrown out of the party, but a very disturbing case there emerging from Madhya Pradesh. And from Uttar Pradesh now, a minor girl was attacked with acid last night in West UP's Hapur district. Doctors say she's in a serious condition and has been referred to a larger government hospital in the neighbouring Meerut district. In a late night tweet, the Hapur police said that they had arrested the man accused by the girl's father of the attack. The father had told the media that the suspected acid was flung at her from a wall when she was working inside her house. In a brief statement, the police said initial questioning of the accused has revealed he carried out the attack after the girl stopped talking to him after a few months of friendship.
आज शाम को 7:30 बजे सिंबावली थाना क्षेत्र में एक लड़की पर एसिड अटैक की घटना हुई थी, जिस संबंध में तत्काल अभियोग पंजीकृत किया गया। पुलिस ने आवश्यक बल प्रयोग करके मुख्य अभियुक्त रोहिल को गिरफ्तार किया है। रोहिल घायल अवस्था में है, इसको अस्पताल पहुंचा दिया गया, जहां इसका उपचार चल रहा है। इसकी स्थिति सामान्य है, आवश्यक वैधानिक कार्रवाई की जा रही है।
Well, let's go across to Alok Pandey now for more. And Alok, yet another disturbing case of a man flinging acid at a young girl just because she rebuffed his friendship or his advances.
Yes, you're right, Gargi. In this case, the police have pleaded to say that they have arrested the main accused named by the father of the girl within 6 hours of the incident. They have also shared images of this man in hospital. He was arrested after an encounter. In a press release issued to local journalists in Hapur, the police have said that initial investigations and questioning of the accused have revealed that he threw acid on the girl because she had stopped speaking with him after some months of friendship. And that is what the police are saying. They'll, of course, need to investigate this more. Also of serious concern, an immediate concern, is the condition of the girl. Her condition is serious according to doctors at Hapur, where she was initially taken, and she has suffered many burn injuries. She has been now shipped to a bigger specialty hospital in Meerut, and one does hope she will pull through. But again, a very shocking incident where at least the police in this case have managed to arrest the main accused.
All right, that quick action is a small saving grace in this entire case. Thanks so much, Alok, for joining us with those details. Now, the latest on COVID and the vaccination drive. NITI Aayog member VK Paul told NDTV in an exclusive interview that a plan to involve the private sector in the vaccination process will be announced in a few days. This has been a demand by many given the slow pace of the vaccination drive so far. He also spoke to NDTV about the emergency use authorization for the Russian Sputnik vaccine in India.
Dr. Paul, when will the private sector be able to vaccinate citizens, particularly those above the age of 50?
Well, presently also, Vishnu, the private sector has been so eminently involved in the vaccination program for the healthcare workers as well as the frontline workers. Out of 10,000 sessions, let's say, on a given day, 2,000 sessions are being conducted by our private sector partners, and they have done such a splendid work. And as we move to a much speedier vaccination program, amazingly speedier vaccination program as we move to the next phase, the private sector engagement would be deeper and wider. We will be coming forth those guidelines and we'll be unveiling this program pretty soon.
How soon would that be, sir?
In a matter of a few days. Just wait, and I assure you that private sector will play a very, very important role to augment the speed and the reach of our vaccination program, even as the public sector would be engaged very, very deeply and intensely. It's a partnership of both public and the private sector.
When will the Sputnik vaccine be cleared? Is there any way to speed up the vaccination process for under 50 citizens?
Well, firstly, we are very happy that Sputnik has applied. Dr. Reddy's laboratory, on behalf of the initiative, has applied for authorization, and let that process unfold in coming days. And you know that we undertake this process very expeditiously because we want as many vaccine options being made available to our people as possible. And therefore, we welcome this move and we are excited about this move. And once that decision is taken, I also know that in parallel, there are a few companies, two or three companies with which they have arrangement to start manufacturing this particular vaccine in our country.
Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Up first, the latest on the vaccine drive. And NITI Aayog member VK Paul told NDTV in an exclusive interview that a plan to involve the private sector in the vaccination process will be announced in a few days. This has been a demand by many given the slow pace of vaccination drive so far. He also spoke to NDTV about the emergency use authorization for the Russian Sputnik vaccine in India.
Dr. Paul, when will the private sector be able to vaccinate citizens, particularly those above the age of 50?
Well, presently also, Vishnu, the private sector has been so eminently involved in the vaccination program for the healthcare workers as well as the frontline workers. Out of 10,000 sessions, let's say, on a given day, 2,000 sessions are being conducted by our private sector partners, and they have done such a splendid work. And as we move to a much speedier vaccination program, amazingly speedier vaccination program as we move to the next phase, the private sector engagement would be deeper and wider. We will be coming forth those guidelines and we'll be unveiling this program pretty soon.
How soon would that be, sir?
In a matter of a few days. Just wait, and I assure you that private sector will play a very, very important role to augment the speed and the reach of our vaccination program, even as the public sector would be engaged very, very deeply and intensely. It's a partnership of both public and the private sector.
When will the Sputnik vaccine be cleared? Is there any way to speed up the vaccination process for under 50 citizens?
Well, Firstly, we are very happy that Sputnik has applied. Dr. Reddy's laboratory, on behalf of the initiative, has applied for authorization, and let that process unfold in coming days. And you know that we undertake this process very expeditiously because we want as many vaccine options being made available to our people as possible. And therefore, we welcome this move and we are excited about this move. And once that decision is taken, I also know that in parallel, there are a few companies, two or three companies with which they have arrangement to start manufacturing this particular vaccine in our country.
Now, the centre has written to several states which have witnessed a spike in daily new cases and asked them to increase testing as well as surveillance in order to control the situation. The states include Maharashtra, Kerala, Punjab, Madhya Pradesh, Chhattisgarh and Jammu and Kashmir. The centre also asked them to increase the proportion of the RT-PCR tests and subject rapid antigen negative people to mandatory retest by the RT-PCR, carrying out regular monitoring of the mutant strains through testing followed by genome sequencing as well as monitoring of the emerging cluster of cases in the state. Earlier we spoke to Sukirti for more details.
So far, the debate has been revolving around mutant strains in Maharashtra, but the centre has now written to all of these states which are seeing a surge: Chhattisgarh, Madhya Pradesh, Goa, Punjab. All of these states have also been written to, and they've been asked not only to increase the number of RT-PCR tests and mandatory RT-PCR tests for those who are testing negative and antigen tests, but also these states have been asked to monitor if there are cluster of cases that are emerging at any places and to carry out checking on whether there is presence of any mutant strains. There should be regular genome sequencing as well. So that is also being asked for from all of these states now. And these states are a big worry because while the national average of weekly positivity rate is around 1%, these states have their positivity rates at anywhere between 3% to 8%. And especially because India has come a long way in this battle against COVID, where we have been seeing a decline in cases across the other states. But these states in the last 1 or 2 weeks have been showing a surge in cases, and that is why they've been asked to control the situation, and testing, tracing and isolation has been the key for the Indian government, and that is why all of these states now being asked to not only increase the number of tests but also carry out checks if there are any mutant strains that could possibly be present.
And now if we talk of the slow vaccine drive in Punjab, healthcare professionals and other frontline medical workers who skip the COVID vaccinations won't get financial help from the authorities for treatment if they do get infected later, and they also won't be allowed to take quarantine or isolation leave. This was announced by the government. The state government has taken a serious view of reports that some healthcare workers are choosing not to get vaccinated amid rising cases of COVID in some states and a low rate of inoculation in Punjab. Let's go across to NDTV's Ghazali for more on this story. And Ghazali, it's meant to be voluntary taking of the vaccine, but given how slow it's been in Punjab, now this diktat by the government, no vaccine, no free treatment.
Yeah, certainly, because Punjab is still fierce among the poor states, which has not been able to ramp up the vaccination, or the vaccination rate is low among the healthcare workers or the frontline workers. Until yesterday, the data released by the state health department suggests that only 38% of the health workers who had to be vaccinated in the first phase, the target has just been achieved up to 38%, forcing the health minister to come out with this statement, asking that all those healthcare workers who are not getting vaccinated now, but if they get infected later, they'll have to take care of their own treatment. Also, the quarantine leaves which are granted will not be, they will not be allowed to avail those leaves as well. So, strong reactions are also coming in from the health officials or the union of workers in the health department. Those they think that it is being imposed. Now, Punjab is in a double fix. One, that the vaccination rate, inoculation rate is low. On the other hand, the mortality rate or the case has also seen a spike in Punjab, which was a bit lull a few weeks ago. So even the Union Health Ministry has sort of suggested the government to ramp up the testing. Now, what is the connection between the two? If you remember, when the COVID outbreak happened in Punjab, we saw that how in the rural areas people were still hesitant even to go out for sampling. Now, similar instances is being reported, or we can say similar feeling has been felt here among the healthcare workers who are hesitant for going for this vaccination drive, and hence even senior officials from the health ministry and other departments have also got vaccinated, but yet the inoculation rate is low, and on the other hand the cases are rising. The experts say that since lowering of guard as the schools and colleges have opened in Punjab, there have been a spike in cases, and they will have to check both, to check the control of spread as well, and also to increase the testing, which is going to be a tough task for the health ministry here in Punjab.
Right, and if the frontline health workers don't come up for vaccination, there will be a worry of when the vaccination drive opens for others. Thanks so much, Ghazali, for joining us with all those details. And let's shift focus now to Maharashtra, where yesterday the Chief Minister Uddhav Thackeray has warned that there could be another lockdown across the state if COVID numbers keep going up. He said there would be clarity on this in 8 to 15 days and asked people to follow the COVID protocols and wear masks. Meanwhile, there are already restrictions in some parts of the state. In Amravati, for example, there's already a lockdown in place till the 1st of March. Let's go across to NDTV Sohit for more on this. Sohit, in Pune as well, restrictions have been put in place, and also restrictions in the state on large gatherings.
Well, that's right, Gargi. Yesterday, in fact, Chief Minister Uddhav Thackeray has said that until further notice, there will be no political, social or, religious programs that would be happening where there will be huge numbers of people that will be attending them. Apart from that, he has given, powers to different district collectors to ensure that the number of cases in their districts come down. So yesterday, while Chief Minister was speaking, he said that around 10 to 15 days ago, there were around 2 to 2,500 cases that were reported in the state. But now the figures have gone up to 7,000 cases per day. So if I tell you the information of the last 24 hours, there has been 6,971 cases reported in Maharashtra, and 35 people have died in the last 24 hours. So after which Chief Minister yesterday spoke, and he also gave a warning that if people don't follow all the precautionary measures, then he will be forced to announce lockdown in the state. However, there have been lockdown announced, as well as several precautions are being taken at different level. For example, if we speak about Amravati, a 7-day lockdown has been announced over there. In the last 24 hours in Amravati, there has been 926 cases reported, after which there will be a week lockdown that will begin at 8 p.m. today, and it will go up till 28th of February 8 p.m. Only essential services will be allowed at that time to operate. If we speak about Akola, there is lockdown that has been announced in several parts of Akola, which includes Akola city, Murtizapur city, as well as Akot. And over here, the lockdown will be from 23rd of February till 1st of March. Several such new guidelines have been given, first by BMC on Thursday, and now by the Pune Municipal Corporation as well as the Pune district officials. Even in Pune, the schools and colleges will be shut till 28th of February. The hotels, restaurants and bars will now be able to be open only till 11 p.m. Earlier, they used to be open till 1 to 1:30 a.m. in the morning. Apart from that, the marshals across the state has been increased. The government is also trying to ensure that people follow these rules properly, and if they don't, they are being fined. In fact, BMC on 20th of Feb, only in one day, they have collected more than 32 lakh rupees in fines. The maximum fine is 200 rupees. So you can understand that the big number of operations that is being taken on. Chief Minister also said that now the cases, 15 days ago, the cases were around 2 to 2,500, which has now increased up to 7,000. So if this is a second wave, he said that we don't know yet if this is the second wave or not, but in the next 8 to 15 days, we will know about this. And if the cases increase and people don't follow all the precautions that have been asked by the government to follow, then he'll be forced to announce lockdown across the state.
All right. Thanks so much, Sohit, for joining us with those details. And Maharashtra remains the big worry as cases are rising there again, and the possibility of another lockdown throughout the state. Well, to talk more about the COVID situation, we're joined by Dr. Padmanabha Shenoy, rheumatologist and immunologist from Kochi. And we'll also be joined by Dr. Muzaffar Lakrawala, advisor to the BMC on COVID. He'll be joining us shortly. But first to you, Dr. Shenoy, a very worrying situation. And Now, of course, the centre talking about the rising cases in 5 states and union territories, etc. But in Kerala, there's been, we've been seeing the cases going up there steadily. What's the situation like right now, and what steps is the government taking?
No, Kerala is a different story when compared to Maharashtra and Andhra. Kerala is a different story because of the Kerala was rising, and now for last couple of weeks, curve is slightly down. Kerala used to report 7,000, 6,000 cases over past 4 or 5 days. For past 14-15 days, number of cases per day is around 4,000, 5,000. Test positivity, which was about 10, has slightly come down to 6, and now it is plateau for last 15 to 16 days. So Kerala is definitely, but Kerala never came down like other states came, because Maharashtra all came down to 2,000, 1,500 cases. Why Kerala is not dipping is, first and foremost, we know zero prevalence in Kerala. That means how many people are immune to this COVID virus is only 10% in most part of the Kerala, even in towns and urban areas. While in Maharashtra and parts of Delhi it is 50%, 60%, or most of the part of the country it is 30%. So Kerala, there are susceptibles are more. That is the first and foremost reason why Kerala is not dipping. And second is, Kerala is much more urbanized than many other parts of the India. Like Kerala is like a big metro, big city. After one city, next city begins, and travel between places is very high. Population density is very high. And third most important factor which we need to watch is whether there is a mutation already has happened in Kerala. Already there are some reports coming out from CCMB and other organizations, IGIB, that there is almost 10% of the viruses are immune escape mutants in Kerala. But the study is very, very limited. What is India is lacking? Like when we started in last March, PCR tests were very scarce. Then we ramped up the capacity that we could do 5 lakh, 6 lakh PCR tests per day. Similarly, need of the hour is to do genetic mapping of virus. Especially in Maharashtra, we are seeing after dipping, there is a rapid increase in cases. So is it because of the easing of the COVID restrictions, or is it because the virus strain has changed?
Definitely, I think because of easing of the restrictions to some extent must be there, given that, the local trains. Yes, Kerala, a few weeks ago, it remained the big worry with cases going up. Now, other states have suddenly seen this spurt in the number of cases. This worry about the mutant strain as well, Dr. Shenoy, are there reports of it in Kerala? The centre has asked all the states to check for the variants as well, because we do know the crisis in Europe right now, in UK and the US, has been caused largely because of these strains that are said to be more infectious. Yeah, very true. Gargi, the problem is we are not studying it. That's the point I am trying to make. We are just studying less than 1% of the total virus strain and trying to make, for example, if we are studying those people who are coming from Britain and seeing whether they are carrying the virus. Yes. But that is not the need of the hour. What we should do is, if you are diagnosing 100 cases in a city, out of those 5 people has to be randomly picked, and genetic sequencing has to be done, and we need to see whether they are behaving differently. In UK is doing 10 to 15% of their samples on a daily basis. We don't have such a surveillance system, and I think that is the need of the hour. And second thing is, whatever may be the mutant virus, the good thing is, if we have mask and we are in an open space, we don't enter closed space, definitely we are safe. Right, and that's the point that the Chief Minister of Maharashtra made yesterday, that please follow the mask rules, and otherwise you'll be facing another lockdown. We have with us Dr. Mufassal Lakdawala. Thank you so much, Doctor, for joining us. A very worrying situation in Maharashtra. I was just speaking to Dr. Shenoy about how, in Kerala earlier the cases were rising, but now they seem to have steadied somewhat and the positivity rate has come down somewhat. But now in Maharashtra, big worry, restrictions are already in place in some areas, and also no big gatherings have been allowed.
Yes, I think what the Chief Minister said yesterday was very, very correct. It is a huge worrying sign. He said that in Amravati, 1,000 cases per day was at its peak, and today it's just 1,000 cases a day. And that's why they've had to shut down the place. The thing is that people have forgotten the very basics of how corona was prevented right in the beginning. Nobody is using social distancing. People have let go of their masks. This false sense of bravado has cost us very dear. And that's where the Chief Minister is coming, that don't compel us to shut places down. It's a kind of request with a stern warning attached to it, that please don't allow us to go back to the dark old days of corona when we were really struggling. Economy was hit. Now it's a envious task to be the Chief Minister of a state which has got the largest numbers, because on one hand, he has to handle the economy, he has to open up the cities and the places. At the same time, he has to convince people to keep putting up those precautions when they're out in public, which people have let go.
Right, and therefore extraneous things like, social gatherings, religious gatherings, political gatherings, he said not to go ahead with that. But doctor, also the worry about the variants, what do we know so far about, how prevalent or the variants may be in the state?
The problem is that Maharashtra was one of the first people to lock down its borders, whether people were coming from the UK, people coming from Brazil right now, from UAE. Unfortunately, people are taking the other route. People are coming from different cities of India, wherein there is no kind of regulation on how they come in. And so it's a sad state that people feel that they can circumvent the rules by using a loophole in the system and actually putting not only the family members at risk, but also all those healthcare workers who've sacrificed so many years, at least months of their life, leaving their loved ones at home and then increasing the numbers. I think that people have to be responsible first. People should not try and circumvent the rules. If they're coming from UAE, UK, wherever, Brazil, for example, they should stick to the compulsory quarantine of 7 days institutional, get tested twice and then come out. Because it's going to be impossible. There's so many mutants. We do know that every virus does mutate. Now, which virus is more infective? Like the head of AIMS, Dr. Guleria, did say that maybe these might be more infectious. We do not know. So it's impossible to keep testing various strains. We do know that the South Africa strain is not even as effective to the vaccine. Another thing that people have let go is they believe that the vaccine has come in, so they let go of all precautions. Now, people must understand that it might take them at least 3 months, even after the vaccine shots, before they might be resistant to this virus. So please don't let go of your precautions until then.
All right, and all the hard work that has been put in by the medical fraternity go to waste. Thank you so much, Dr. Lakrawala and Dr. Shenoy, for joining us on the show this morning. Well, with that, time for us to slip into a short break. Coming up on the other side, we'll get you the latest on the farmers' protest. Stay with us. Welcome back. Now, the latest on the farmer protest, and as many as 248 farmers have died during the protest against the 3 central agriculture laws in 87 days. Now, this is according to data collected by the Sanyukt Kisan Morcha. Let's go across to NDTV's Ghazali for more on this. And Ghazali, so they've been collecting all this data on farmers' death, and it's actually 248 now?
See, certainly, and what is the relevance of this data, Gargi? Because Punjab has seen or has been seeing farmer suicides in the last two decades. And it often happens that while giving compensation, the data compiled by the government sources is way too less than what is the data or what the actual number of suicide cases. So it has been seen that many farm unions individually, they keep collecting the suicide deaths in Punjab. One of the farm unions, Ugraha, BKU Ugraha, Bharatiya Kisan Union Ugraha, has its members who keep collecting these suicide deaths across Punjab based on vernacular press reports or even visiting villages to collect the data. So similar thing happened here post November 26 when the agitators started gathering near the Singhu and Tikri border, that we started getting reports of how people are dying natural deaths due to heart attacks and all. So the Sanyukt Kisan Morcha and many other independent organizations from Punjab are also compiling data. They are putting it online and are also giving options for people to contribute or monetarily support these farmers, because this data is very important to show that how many people have lost their lives against this agitation against the farm laws.
Right, Ghazali, thanks so much for joining us with those details. So 248 farmers have died during the agitation so far. With that, time for us to slip into a short break. Coming up on the other side, political leaders headed to poll-bound states. The Prime Minister will be in Assam and West Bengal. We'll get you all the details. Welcome back. Political leaders are headed to poll-bound states, and while the Prime Minister will be in Assam and West Bengal, Congress leader Rahul Gandhi will be in Kerala. Now, let's talk about the Prime Minister's program today. First, he will be in Assam. Will dedicate to the nation important projects of the oil and gas sector in Dhemaji and also lay foundation stone for an engineering college. He will later be in Hooghly in West Bengal. Let's go across to Saurabh for more. And Saurabh, we're expecting election dates any day now, and today the Prime Minister will be in West Bengal. Right, Saurabh, can you hear me?
The Prime Minister is expected.
Right, Saurabh, go ahead. I was just saying that, we're expecting poll dates any day now, and today the Prime Minister will be in 2 poll-bound states, Assam, and then he'll be in Hooghly in West Bengal. Tell us about the program.
Well, the Prime Minister is coming in on a day when the Trinamool Congress is also raising the ante as far as the raid on, or the CBI summons to Abhishek Banerjee's wife and also his sister-in-law is concerned. Now, the Prime Minister will be at Hooghly at the Shahganj, Dunlop grounds. That is, of course, the place where, jobs are a key issue. Remember, the Dunlop factory has been shut. The Trinamool briefly tried to open it after it came to power, but that factory has been shut. But of course, today the Prime Minister goes there. Hooghly district is one area where the BJP hopes to do well. It's an important district. It has about 16 seats, and that's why that's one district where the BJP has really made massive inroads. In fact, a little bit of history about Hooghly district. The first MP from Hooghly district was Somnath Chatterjee's father, N.C. Chatterjee, who was actually elected from the Hindu Mahasabha. So the BJP has made inroads in that district. Now, apart from that, yes, the Prime Minister is also going to inaugurate metro projects and, another railway project in Cooch Behar. But that is, of course, part of the program, official program, and then, of course, he has his political program. Usually, we've seen these events being clubbed, a political rally along with an official program. That's been the pattern with BJP leaders, at least as far as the top two are concerned, Prime Minister Narendra Modi and Amit Shah. Now, of course, I am at Abhishek Banerjee's residence where CBI teams are expected. There's a summons to his wife and also to his sister-in-law. That is something that Trinamool has been crying foul over. And obviously the timing of this raises questions given the fact that this probe has been going on for a while. But the CBI, sort of acting right ahead of elections does raise, of course, at least the TNC says, is that, this is, of course, political vendetta. And remember, that is something that the agency has been accused of, targeting opposition parties, targeting opposition leaders, not just in West Bengal, but in other states as well. If you see Maharashtra, again, the CBI and ED have been accused of targeting opposition parties. Same here. In West Bengal, the Trinamool says the CBI is trying to, these are intimidation tactics which won't work. In fact, Abhishek Banerjee came out with a strong statement saying, we have full faith in the law of the land and these intimidation tactics won't work.
Right, Saurabh, thanks so much for joining us with all those details. And let's just take a look at what Mamata Banerjee also said about after the CBI visited her nephew's residence and in search of the wife who they wanted to join this case that they are investigating. Mamata Banerjee asserting that her mother tongue Bangla has taught her to fight like a tiger and not be afraid of rats.
আমি কোনো ধমকানি চমকানিকে ভয় পাই না এবং পাবো না আমাদের মেরুদণ্ড ভেঙে দেওয়া অত সহজ নয় বাঘের বাচ্চার মতো লড়বি বাঘের বাচ্চা যেন বিড়ালকে দেখে ভয় না পায় ইঁদুরকে দেখে ভয় না পায় দেখি কার জোর কতটা বেশি একটাই 21 খেলা হবে আমি থাকবো গোলরক্ষক সেই খেলাতে কারাই হারে আর কারা জেতে এটা আমি দেখতে চাই
सीबीआई का काम करेगा सीबीआई का काम है उनका काम करना इसके साथ कुछ राजनीतिक संपर्क नहीं है हम लोग सब लोग जानते हैं जो काउ स्मगलिंग जो कोल का जो है दुर्नीति सब जगह में अभी सब इंक्वायरी हो रहा है इसमें बहुत सारा नाम भी आया है अब आप लोग भी जानते हैं तो इससे ही पूरा जाता है आगे निकलता है ये
All right, so the Prime Minister will be in West Bengal today, and as we said, Congress leader Rahul Gandhi will be in Kerala today. Today he will lead a tractor rally and attend a farmers' meet against the farm laws in Wayanad, his constituency. Rahul Gandhi will lead a 6-kilometer-long tractor rally against the farm laws brought in by the centre, over which there have been protests for nearly 90 days in the national capital. So today Rahul Gandhi, they're participating in a protest in Wayanad. Rahul Gandhi will lead a rally with 200 tractors and thousands of farmers and labourers in Kerala and Wayanad district today. Now, the latest on Puducherry, where 2 more MLAs resigned on Sunday in a major setback to the ruling Congress a day before the trust vote, which is today. One of those who resigned was from the Congress, the other was from its ally, the DMK. Now, the 33-member House has a strength of 26 and the Congress and allies have just 12, while the NR Congress-led alliance has 14. Now, there could be a number of possibilities in Puducherry today. There could be the government could fall, or the government could survive, or Chief Minister Narayanasamy could dissolve the assembly. Well, let's go across now to NDTV Sam Daniel. Sam, tell us, what is the latest?
Well, the assembly is all set for the trust vote, which will begin at 10 o'clock in a short while from now, Gargi. And the Lieutenant Governor in her letter had asked the assembly to conclude the proceedings before 5 o'clock. And the Chief Minister Narayanasamy, who would take the trust vote, has left his residence. We understand he is on his way to a temple before coming to the assembly. And as you said, there could be at least 4 or 5 different possibilities what we can expect. As things stand now, it appears Narayanasamy has lost numbers terribly. The Congress has a total of 12 MLAs, including 2 from the DMK and 1 independent candidate. At the moment, there are 26 MLAs available, including the 3 nominated MLAs. And 1, the government could fall. 2, the government could survive. The strategy perhaps could be the Speaker could deny permission for the 3 nominated MLAs to cast their vote. In that case, the numbers will come down to 23. And automatically the ruling Congress would have enough numbers to prove its majority. Third option, of course, is the government could fall and the Lieutenant Governor either could ask the NR Congress, the opposition, to try and form the government, or she could order President rule. Elections are anyway due in a few months in Puducherry, Gargi. So whether she would ask for a new government to be formed, or will she announce President rule, and will they wait for the scheduled elections? That's something we'll have to wait and watch. But certainly over the last 24 hours, a major setback, as 1 Congress MLA and 1 DMK MLA have quit the party. The Congress MLA says he has not been given enough recognition. Although he has been a 4-time MLA, he was neither made a speaker nor given the Congress Union Territory chief position, although he says he has contributed a lot to the party. On the question of whether he'll join the BJP or any other party, he says he will take that call after consulting his supporters. So a significant day in Puducherry politics. We'll have to wait and watch how things pan out. Significantly, the 3 nominated MLAs, actually, they are from BJP. Although they cannot be technically called as BJP MLAs, they are from the party and they've been nominated. The Supreme Court last year had allowed them to vote. We'll have to wait and watch whether the Speaker would overrule that, leaving it open for another long legal battle to help the ruling Congress save its government here. That's something we'll have to wait and watch.
Right, Sam, thanks so much for joining us. Sam there getting us all the latest on the developments in Puducherry. Well, returning now, all right, well, let's just take a look at what Chief Minister Narayanasamy had to say.
Honorable Ministers, Honorable MLAs of Congress and DMK Alliance Party members, and Honorable MP, Honorable our PCC President A.V. Subramaniam. We met and discussed. Honorable Deputy Speaker was also there. We discussed about the strategy to be adopted by our Alliance Party in the Assembly, Legislative Assembly. Finally, we have decided that we will disclose our strategy in the floor of the House at the time when the Assembly commences.
All right, so that is what the Chief Minister said yesterday. Well, returning to news from Kerala, and Rahul Gandhi will be in Kerala today to lead a tractor rally in his constituency, Wayanad. Let's go across to NDTV Sneha for more. And Sneha, tell us about the plan. There'll be some 200 tractors.
Well, that's right. In fact, Rahul Gandhi has a series of programs in his constituency, which is the Wayanad parliamentary constituency today. He's going to be there. One of the major programs is a tractor rally, which will be having around 200 tractors. And Congress has claimed thousands of agricultural workers, farmers are going to be part of this tractor rally. Now, this is part of the series of protests by several leaders, even from the Congress, against the centre's farm laws. Now, interestingly, Wayanad, Kerala is not a very agriculture-intensive state, as it were. But Wayanad is one of the few districts where agriculture is pursued in a considerable manner, and this also is the parliamentary constituency of Rahul Gandhi. So this being the prominence with which this tractor rally as well as the farmers protest will be seen. Now, Kerala is also a state where the left as well as the principal opposition UDF both have opposed the farmers' laws which was brought in by the centre. So this is expected, the tractors rally is going to be around 6 kilometers within Wayanad and is expected around noon today. Gargi.
All right, thanks so much for joining us, Neha, with the latest there. News now from Madhya Pradesh, where a 20-year-old woman in the Shahdol district was kidnapped, kept captive at a farmhouse for 2 days and then allegedly repeatedly gang raped by 4 people. One of the accused is a local leader of the ruling BJP, though the BJP has now dropped him and claimed he was no longer a member of the party. The rape survivor's family said that she was kidnapped on the 18th when she had gone to buy groceries. Initially, they didn't lodge a missing complaint, thinking that she may have gone to a relative's house, but then she was found unconscious state near a house on the 20th of February, hours after they filed that official complaint.
और इस महिला ने शिकायत करी है कि 4 लोगों ने उसको कार से उसको जबरदस्ती एक जगह पर ले गए। वहां पर एक व्यक्ति ने उसके साथ रेप किया है, बाकी लोगों ने उसको सहयोग किया है। इस प्रकार की रिपोर्ट पर से थाना जैतपुर में अपराध पंजीबद्ध हुआ है और अपराध पंजीबद्ध करके थाना जैतपुर उसकी विवेचना करेंगे।
And another case of a woman being attacked, a minor girl, in fact, in Uttar Pradesh. This time she was attacked with acid last night in the Hapur district. Doctors say she's in a serious condition and has now been referred to a larger government hospital in the neighboring Meerut district. In a late night tweet, the Hapur police said they had arrested the man accused by the girl's father of the attack. The father told the media the suspected acid was flung at her from a wall when she was working inside the house.
आज शाम को 7:30 बजे सिंबावली थाना क्षेत्र में एक लड़की पर एसिड अटैक की घटना हुई थी, जिस संबंध में तत्काल अभियोग पंजीकृत किया गया। पुलिस ने आवश्यक बल प्रयोग करके मुख्य अभियुक्त रोहिल को गिरफ्तार किया है। रोहिल घायल अवस्था में है, इसको अस्पताल पहुंचा दिया गया, जहां इसका उपचार चल रहा है। इसकी स्थिति सामान्य है। आवश्यक वैधानिक कार्रवाई की जा रही है।